Hey there, welcome. This is colorectal screening and genetic testing made easy. My name is Jerry Camarda. I'm here to talk to you about Cologene OBC. I'm going to talk to you about how I can save your valuable time and quite possibly your life. We're told there are certain things that we must do to maintain our healthy selves. We get our teeth cleaned every 6 months. We have yearly wellness checks with our primary care providers. He or she usually does lab work to make sure our blood counts, chemistries, cholesterol, and maybe some other things are all okay. For us women, we have a yearly gynecological exam. We get mammographies every year after the age of 40, and prostate exams are given to men. Then after 50, we're all asked to do colonoscopies every 10 years. And we're all asked to bring home those wretched stool cards for our colorectal screenings. Although we all feel having to do this is, well, a pain in the tush. It is a great screening. Unfortunately, it's only a screening. When you see your primary care provider and you bring home those cards, you're asked to collect stool from 3 different bowel movements over at least a 3-day span. Ugh. But who wants to do that? Then we put the cards in the mail and wait to hear back. If blood is present, then they ask you to go on to the next step, which is to schedule a colorectal screen or colonoscopy. Then they tell you if they come across anything suspicious, they will biopsy it. That's time off of work, more medical expenses, and just more time waiting. You have to wait to get the procedure scheduled, then you have to wait to get the results. Who has time to wait? In our microwave society, no one has time to spare for testing that takes multiple steps. What if I can introduce you to a way that you can collect your stool, mail it in, and receive all your results at once? One test that can provide you with all you need to know about whether you have colorectal cancer, if you have the genetic makeup that would increase your chances of getting colorectal cancer, and indicate if you have the genetic makeup that would inhibit treatment. Who wouldn't want to do that? Here are the basics. The collection kit is extremely simple. The stool is collected at home in the privacy of your own bathroom. Stool is then placed in a sterile container. It is sealed and then placed in a package that would keep the specimen at 2 to 8 degrees Celsius, so your normal refrigerated temp. It's also packaged for overnight delivery to our testing facility. Once it's in our laboratory, stool is applied to a test window on a cardboard cartridge. This cardboard cartridge is very similar looking to what we use to test for occult blood. But this cartridge has a double-paned window. On one side of the cartridge, it is set up for testing of the presence of blood. The side of the window opposite is where stool is applied. The cardboard cartridge is composed of simple immunoassay for the detection of blood. With a few drops of developer, like we're all used to having to do for occult blood, it will tell you if there is the presence of blood by a 2-line indicator in the result window. Now, if there isn't any blood, there are epithelial cells that are present. They are sloughed off of the colon as stool passes through. Fun stuff. Epithelial cells are also a good source of DNA material for testing. Now, if you turn the cartridge over from the application side of the window, the paper insert is removed from the cartridge. The paper from the window is then used for DNA extraction, amplification, and testing. This part of the methodology is very, very similar to how they remove DNA material from forensic typing in the TV shows, those forensic crime TV shows that we all love to watch. You know, the ones where there's a perpetrator who leaves a cigarette butt behind, and the crime scene investigators use part of the cigarette butt for DNA material. It's the same concept. The paper insert is placed in a test tube with a lysing agent. This lysing agent will remove the waste material from the DNA within the blood and epithelial cells in the specimen. The tube is vortexed. The supernatant is removed and placed in a new tube with a cleansing agent. The cleansing agent will remove any more waste material and any residual lysing agent in the solution. It is then again vortexed, and the supernatant off of that is then placed into a new sterile tube. That is what is then introduced to a PCR thermal cycler for the amplification of DNA. Once the DNA is isolated into a prime testing specimen, it can be used in a microassay for genetic makeup that makes you, well, you. What is so important about that part is that we can tell you by your genes if you have colorectal cancer. This means the elimination of invasive colonoscopies, not to mention the time off of work and to have to pay extra bills. And let's not forget the notorious prep work that it takes to get ready for the colonoscopy. And like a crystal ball, we can tell from your genes if you carry the genes that indicate you will likely eventually end up with colorectal cancer. Knowing if you're going to end up with this type of cancer will save you the time that you can use to later spend with your family or whatever you'd like to do. Additionally, that can also indicate genes that would inhibit certain types of drug therapies. Worst case scenario, okay? You have colorectal cancer. You are better equipped to fight it rather than waste time with therapies that don't work. Therapies that can keep you from your remission. Delicate time that could save your life. Now, I'm not trying to scare you into thinking that everyone either has or will have colorectal cancer, but in this day and age where we have to concern ourselves with so many health concerns, why should we keep it so complicated? Colorectal cancer is just one of many screenings. Do you know that colorectal cancer is the second leading cause of cancer-related deaths in the U.S.? Current risk factor is 1 in 20 individuals, and 90% of those are over the age of 50. Let us help you save time, money, and worry by using our one-step Cologene OBC for the testing of colorectal cancer. Right now, there is 1 million cancer survivors living in the U.S. We would like to use our product, Cologene OBC, to make sure that all colon cancer patients are cancer survivors. Thank you for your attention and, of course, for your support.